October 15th was established in 2003 as National Latino AIDS Awareness Day in response to the devastating impact HIV and AIDS has had on Hispanic Latino communities across the country. It was established to draw attention to the critical role HIV testing and prevention education plays in stemming the spread of HIV and AIDS among Hispanics and Latinos. It is a day during Hispanic Heritage Month that organizations around the country use to promote and sponsor activities that respond to the state of HIV and AIDS among Hispanics in their specific communities. It is National Latino AIDS Awareness Day is the only grassroots nationwide social marketing campaign, and it has really risen since its concept in 2003. There are many cities, mid-sized, small, and large, who use October 15th National Latino AIDS Awareness Day to spread the message. In the United States, the HIV/AIDS epidemic has adversely affected Hispanic Latino communities. Cultural and familial norms act as obstacles to prevention efforts, thus contributing to high levels of HIV infection. That speaks for itself. Hispanics and Latinos progress to AIDS faster than any other racial or ethnic group, with 42% being diagnosed with AIDS within 12 months after learning of their positive HIV status, compared to 34% late diagnosis among the white, non-Hispanic, and 35% among blacks. Approximately 19% of Hispanics and Latinos within the United States are living with HIV or AIDS. This year's theme is Save a Life. It may be your own. Get tested for HIV. And I think that's the precedence that we need to make when we're working with the communities to get these folks tested. I know the health department in Yuma County is reporting something like 106 HIV cases. I also know the health department is out there trying to get people tested, among other organizations. If we don't get these folks tested, they're out there without any wherewithal of whether or not they have HIV or not. And what ends up happening so often is the statistics prove is that they go into the hospital because they're sick, they find out they have AIDS, and oftentimes it's too late to get them treatments, and we lose them. Okay? HIV is a highly treatable disease in comparison to what we dealt with in the 80s and 90s. But we've got to get people tested, and we've got to get them treatments. A lot of folks in Mexico don't have direct access to treatments. They may know that they have HIV, but they don't have that direct access to treatment. We've got to improve upon that. We've got to help our neighbors in Mexico improve treatments and access.
And social determinants are all those things in our lives that impact everything that happens to us, whether it's health outcomes, whether you end up living in a shelter, whatever it is. It's all the pieces of the pie that I think up until now public health has really ignored. It's about policy impacting the way I'm going to respond to you, even though I'm there to serve you in some way. The law is actually very, very prohibitive. And the minds of people who don't understand the law or think they have some understanding of the law, they won't come forward. I'm not going to give you the names of my partners. But how do I know that you're not going to turn them in? I don't know what's going to happen as a result. It's a social determinant. There is an Arizona, what do we name it? It's the Arizona Latino HIV/AIDS Network. It does exist. It is a statewide organization. And it's being facilitated by the National Alliance of State and Territorial AIDS Directors. They actually helped us put the first meeting together. Not only does Arizona have that group, but Arizona also has the Arizona Black AIDS Task Force, which is now in its second year, and the Arizona American Indian HIV/AIDS Task Force has been around about 12 years. So we do have community groups representing some of our minority neighborhoods who are very, very active in terms of getting information, doing events that are around the National Awareness Day events. I mean, there's a lot of activity going on. Actually, the World Health Organization was the first organization to identify social determinants, and they put together, they appointed a commission on social determinants about 6-7 years ago, and they met for 5 years. They had a limited lifespan. The whole idea was we want you to start looking at social determinants and understand that they were doing this globally. And we want you to make recommendations as to how to best address these determinants. In terms of the definition, they're the conditions in which people are born, grow, live, work, and age, including the health system. So it's all of our conditions, everything that impacts us in some way or another. These circumstances are shaped by the distribution of money, power, and resources. We always want to leave economy out of this discussion. The poorest people are the ones who are most vulnerable. If you look at where HIV and AIDS has had the most impact in the world, where is it? It's Africa. Where are the poorest people in the world? Hello? It does have great impact on health outcomes. We cannot ignore global and local economies. The wealthiest people in your area are also going to have the least health issues. Sorry, it's the truth. What we try to do is figure out what is causing these kinds of inequities in health outcomes. And we call that health disparities, health inequities. And there are several things that play into why we see these inequities. One is you're going to look at the systems of care. Are the systems of care something that are they accessible? Are they culturally appropriate? Do they have what is necessary to be quality care? So you want to look at the systems of care. You want to look at historical factors. And you also want to look at the social determinants. And actually, those are part of the social determinants, but I like to separate those out because I think they're very, very important. Historical factors are more tied into, well, to every group. Distrust of governmental systems. Distrust of organizations who get governmental money. There's historical precedence for this. Why do we look at social determinants? Because this is all wrapped up in where stigma comes from. Stigma's there because it's a way that people protect themselves. The fact is that 50% of the new infections in the United States are female. But let's not deny any of that. And it doesn't matter if you're married or not. It doesn't matter if you're single. It doesn't matter actually if you're a lesbian, even though lesbian women have far fewer numbers. Many lesbian women were actually married to guys at some point. Stigma is very hard, but it's very linked to who we are, and it's very linked. It comes from someplace. This is not just because we're kind of superficial people who are just afraid to talk about sex. Our history dictates it. And we have to overcome a history that has ostracized and oppressed every person in this country who wasn't white, male, and straight. If you look at social determinants, there are reasons for why people are the way they are. Acculturation has a lot to do. Assimilation. Everyone who wasn't white, male, and straight has had to assimilate to this country. It's very hard to deal with our own reality. We had a president who refused to say the words AIDS. Refused. For years. It was a country that absolutely did not care. But it also did spread throughout all the other communities. And people ask me all the time, why is HIV so prevalent in the black community? Well, you know why? Because in 1982, we were already 28% of those who were infected. In 1982. What portion of the American population do African Americans make up?
Well,